in those infections that are emerging that are non-responsive to the leading antibiotics available, and we have to invent new ones or use multiple ones, or there's just a few holdout pharmaceuticals or antibiotic options that will be effective against these pathogens. Essential oils, the different volatile oils, as I said before, can certainly help complement antibiotics and therapies, but all volatile oils are powerful antimicrobials.
I wanted to take what you spoke about in terms of really working with the terrain and focus on different aspects of that. And so, what I'd like to share too is that sometimes when there are drug-resistant infections, some of the basic things get overlooked in terms of just really good lab work. And so, in terms of being a provider, making sure that when a patient comes into your care to really look at what's been done and to see if you can further enhance the understanding of why there is a persistent infection in that individual, or there's trouble with controlling an infection in an individual by just looking at some basic labs. And so, at minimum, these are some of the labs that we'll look at in conditions like this. So total immunoglobulins, it's a pretty easy lab to order where you can get the total amount of IgG, IgM, IgA, and IgE levels. I usually will take it a step further and we'll look specifically at IgG subclasses. And so think about NAC in terms of their N-acetylcysteine and how it is such a great mitochondrial support. And so it's often something that is included in treatment plans that I'll build where we're treating difficult to treat infections.
I'm going to try to just, pull back a little bit and, go back to my Chinese medicine roots here and, stick with this kind of ecological environmental side of things, because I feel like I just got a huge download on a lot that I didn't understand about antibiotic resistance. Thanks so much from both of you. And I think, there's so much ground that we could cover, and I definitely want to make sure that we have time for questions. But I do also want to just kind of elaborate on what I think is really important in the whole issue, and I think part of what we're experiencing right now is that there is, I think Jill, you made reference to this, just that there's really an epidemic coming on, and we're kind of entering a new age of medicine, especially in this realm, kind of the age of antibiotic resistance, where it's just accepted. And part of it is that we've overtreated, like like mentioning just how feedstocks and livestock have taken, the lion's share of the antibiotics and absorbed them into the ecosystem through that medium, through their feed, into their bodies, injections, everything else. Also, let's see, I got another slide here on this one, just a better list so you can see. These are some polyphenols that you're probably really familiar with. They're also really great for mitoprotection. They enhance mitogenesis. They prevent the reactive oxygen species by enhancing the mitochondria's ability to quench free radicals, not by going out there and scavenging the free radicals being antioxidants. We got to move past that. And then there's things in here like the catechins, right? EGCG, which is very specific and has been shown to be, really beneficial when combined with beta lactams, for example. And the berberine, again, like one that's been shown to be really great in combination.